Different kinds of neck lifts, including traditional neck lift, mini neck lift, maybe even the deep neck lift. What's the actual difference between all of them? Well, here's a quick video. In terms of a neck lift, first, of course, we have to define what a neck is. So, of course, the neck is what we think it is, right underneath the jawline or mandible, and this is where the neck action, for the most part, is happening. It is important to know for rejuvenation purposes that the neck also may include the jawline. So what I'm talking about today is only pure neck. Specifically, I'm not talking about lower third facial rejuvenation, which a lot of patients do need. I'm talking mainly about the neck. If your actual concern is a jowl or jawline, then you may need a facelift and a neck lift. So for isolated neck issues, there are a couple anatomic structures. The first is what we can see, which is the skin. Right underneath the skin is a fat, also known as a double chin or submental chin. In terms of the underneath structures, we're talking about the platysma muscle, which is a thin sheet of muscle that goes all the way from here to here, sort of underneath the jawline down to actually the collarbones. And what that does is it's a thin sheet of muscle that, as we age, can separate here, gives you sort of a stringy neck, if you will. A lot of patients may think that they have a sort of a turkey neck, and that may be a combination of extra skin, fat, and actually platysma that gets a little loose over time. Finally, there are structures underneath the platysma, and these structures are deeper neck structures, including the submandibular glands and actually the muscles right here, the anterior digastrics right about there. You don't have to necessarily obsess about what these names are, but just know that they're under the platysma. What is a mini neck lift? To be honest, in plastic surgery, there's no real great answer. I do think in terms of consumers, what you think of is mainly just an incision that goes underneath your chin or just behind it, possibly two tiny incisions around your earlobe so we can actually do liposuction. We can actually remove that fat just underneath the skin, and we can allow your body to heal and tighten up the skin underneath. I have also seen a mini neck lift where you only have an incision behind the ear. So it could be just behind the ear or just behind the ear and actually extending into the hairline. But the most important thing is there's no incision in front of the ear. That to me are both consumer definitions of what a mini neck lift is, but that's not really what we think about as plastic surgeons, because to be honest, I think it's part of a traditional neck lift. Now, with a mini neck lift, we can remove fat. We can't really tighten skin unless we make an incision behind the ear, because we want that neck skin to be going somewhere. We want that neck skin to be tightened around the jowl, the jawline, and it has to be draped somewhere, so we typically put it behind the ear. How much loose skin you have sort of depends on you, how much pull we can get, your skin laxity or how tight it is, and other factors. Typically with the mini neck lift, it's hard or impossible to actually tighten the platysma muscle, but again, we can do it. If I remove the fat in your double chin, I'm actually right on top of the platysma muscle. If it's separated slightly, if it's a little too loose, I can actually tighten it through this chin incision here. Now, with a traditional neck lift, this is where it sort of encroaches or it overlaps with what a mini neck lift may mean to some consumers and some plastic surgeons. A traditional neck lift will make an incision underneath the chin and actually behind the ear. This way I can redrape the skin, I go underneath the skin, I can pull it taut at the end of your procedure, and I can reposition it. I may need to trim a little behind your ear and around your hairline. While this is open, I can actually remove the fat, I can tighten the neck muscles, and that is known as platysma muscles, if you remember, and then I can redrape everything very nicely. So that's what a traditional neck lift is. Now, what is a deep neck lift? We use the same incisions, however, we're going after deeper structures. So you remember the submandibular glands, which are around here? Those are salivary glands that are sort of small, can get a little beefy though, especially if you're redraping the skin around the jawline and in the neck area. And so what I need to do is actually shrink them. Now, the surgical way is, of course, to isolate them and physically remove them. There's actually a non-surgical way, which is injected with Botox or botulinum toxin. So those are two major ways that you can actually shrink the submandibular gland. But essentially, if you could feel it and if it's dropping down, and even in the operating room, when I'm tightening the skin, tightening the muscle, there's still a little bulge that sort of hangs down there. That's probably the submandibular gland, and I probably need to do something about it. Now, in terms of the anterior digastric muscles, those are right here. Those are deeper than the platysma. When I'm redraping the skin, it still hangs down a little. Resecting that, removing a little sliver of that, will help with your overall look long-term after your surgery. So that's what a deep neck lift is. And of course, you still may actually have fat underneath the platysma muscle. Now, if you remember, you have skin, you have fat, and you have platysma muscle. Well, sometimes in some patients, there's actually fat underneath the platysma muscle. So defatting that area before tightening up the platysma muscle is what I do. Now, in terms of the platysma muscle, remember, it's a sheet that goes sort of up and down all the way around your neck, all the way along the right left sides. It's often split or not united in the middle. I think, honestly, genetically, some patients may simply have it, but as we age, it becomes a little more noticeable. So what I actually have to do is reunite the right and left sides. I need to make a cut in this direction, horizontal, pretty low, so that it redrapes nicely over the neck. And then I need to reposition the skin over it. So that's what a platysmoplasty, you may have heard that term, means. In other words, I'm doing something to the platysmal muscle. Now, in terms of the actual neck lift, you know now that the three major options are mini neck lift, which means different things to different people, traditional neck lift, as well as a deep neck lift. I hope knowing some of the terms and the anatomy helps you understand things. To be honest, in terms of trends, there is a trend towards deep neck lift surgery. However, I do think that not all patients need it. So you don't necessarily, for example, really have that much fat underneath your platysma. Your submandibular glands, your salivary glands right here may not be that prominent. And you may not have much of a muscle here deep underneath everything to really be removed. So it really depends on your specific case. So there are other couple add-ons that we have for all three types of neck lifts. I think the first one is the horizontal lines in the skin. We can address that with filling it with fat. We can do it non-surgically with filler, but since we're operating and since we're in surgery, fat is, I think, a better filler, much more long-lasting, can rejuvenate the skin, and can actually heal up a little better, give you a little better color correction as well, to fill in the horizontal lines which go across your neck. Now, I hope you understand as well that even though these definitions may be a little vague, the true answer is that traditional neck lift and deep neck lift do tend to have distinct meanings. The mini neck lift is sort of an outlier. In other words, that's more of a consumer term. It's not really taught in plastic surgery textbooks. It certainly wasn't taught to me. And even in articles today, there's no hard definition of it. The mini neck lift, I think, implies smaller incisions, not as long incisions, and not as much surgery. Not that that's good or bad, because if you need lesser surgery, if you're a younger patient, then a mini neck lift may be all that you need. Typically, if you have more issues with your muscle, the structures underneath the platysma muscle, or a lot of loose skin, a mini neck lift is not the answer, because you will need the skin to be redraped and the muscle tightened properly. Finally, as mentioned before in the video, if you have issues with jowling, a Jowling, as well as you want a really sharp jawline, just a neck lift alone may actually not deliver the best results. The reason why is you may actually need your facial skin tightened right here in front of your ear and around your earlobe. So that depends on you. That depends on how much skin laxity you have and your specific anatomy. So if you have any other questions, let me know. And I hope this video answers all of your questions. If you have any other concerns, please fire away, let me know in the comments. And as always, there are other videos to watch here on my YouTube channel. Thanks so much for coming by.